I'm going to provide our patient with some privacy. I'm going to perform hand hygiene, and I'm going to assess the lighting and the temperature of the room is appropriate for the patient. Hi, I'm Holly. How are you doing today?
How are you?
Good, thank you. What's your name and date of birth?
Angela Pinazzoli, July 16th, 95.
Great, let me do. Perfect. Angela, I'm going to be performing your head to toe assessment today. I'm going to note the general survey of the patient. The patient appears appropriate age, sexual development is appropriate, clear level of consciousness, the hygiene is appropriate, patient is dressed appropriately for the occasion. The posture is erect, head and neck is erect. Posture is straight, head and neck is erect. Patient has a clear, even skin tone, and the patient's speech was very clear. Next, I'm going to ask the patient to memorize 4 words during this interview that I'm going to ask to recall 3 times. Those words are blue, moon, love, and smile.
Blue, moon, love, and smile.
Perfect, thank you. Now I'm going to assess the patient's vital signs. I'm going to assess her respiratory rate, her radial pulse, her blood pressure, her temperature, her height, weight, and her BMI. Now I am going to assess the patient's head. I'm going to note its normal cephalic, even full hair distribution. I'm going to perform cranial check number 7. Ask the patient to smile, frown, and squint. Perfect, thank you. I'm going to palpate the temporal artery, which is present on both sides. If you will open and close, I'm going to palpate the temporal mandibular joint, noting that there is no crepitation and smooth movement. Next, I'm going to palpate the patient's sinuses. Do you feel any tenderness or pain? No. Tenderness or pain? No. Perfect. Now I am going to move on to the patient's eyes. If you will read this at the very top from 14 inches away.
And concept map.
Perfect, thank you. Now I'm going to note that the patient's eyebrows, eyelashes, eyelids, and eyeballs are all bilaterally symmetric and smooth movement. Note the scleras are clear. If you will pull down on your eyes, I'm going to note the conjunctivi is pink. Corneas are clear, smooth, no cloudiness noted. I'm going to ask that the patient look at my leg. I'm going to note that the reflection is equal on both ends. I'm going to ask the patient I'm going to check pupil and accommodation, ask the patient to stare at my head. Eyes go inwards, pupils constrict evenly. Now I'm going to ask that you look straight ahead. I'm going to come at you from each side and you will stare straight ahead. Perfect. Perfect. Pupils constrict on both sides equally. Next, I'm going to check cranial nerves 3, 4, and 6, the 6 cardinal positions of gaze. If you will keep your eye on my pen and follow with just your eyes. Smooth movement in all areas. Now I am going to ask that you repeat those 4 words for me.
Blue, moon, love, and smile.
Perfect, thank you. Now I'm going to inspect the ears. I'm going to note that they are symmetrical and even on both sides. I'm going to check the canals. The canals are both open and even. I'm going to palpate the auricles. Do you feel any tenderness or pain?
No.
And any tenderness or pain on the tragus?
Nope.
No? All right, now I'm going to perform the whisper test, which is cranial nerve number 8. I'm going to whisper 3 letters from 2 feet away.
A, B, C.
Perfect.
1, 2, 3.
Perfect, thank you. Now I'm going to move on to the nose. The nose is center and equal. I'm going to palpate that it's soft, ask the patient to look up. Perfect. I'm going to note that the nasal mucosa is red, no deviation noted, and the turbinates are light red. I am going to I'm going to ask that the patient place their finger over here. Inhale, Inhale, that's checking for the patency of the nares, and both are open. Now I'm going to check cranial nerve number, close your eyes. Cranial nerve number 1, I'm going to ask the patient close one nostril. If you will smell this, can you tell me what, perfect. If you'll do the opposite nostril, smell this.
Alcohol.
Perfect, thank you. Next, moving on, I'm going to look at the lips. The lips are pink and smooth. If you'll open your mouth, perfect. I'm going to note that the buccal mucosa is bright red and smooth, pink and smooth. The hard palate is white with transverse rugae. Soft palate is movable and pink. If you will stick your tongue out, perfect. That's checking cranial nerve number 12. If you will open your mouth and say I'm going to note that the uvula, the pendulant, fleshy pendulant in the back raises to midline, checking cranial nerve number 10. The tonsils are graded at a +1 because they are present. Next, I am going to check cranial nerve number 9, which is going to be the gag reflex. If you'll open. Perfect, thank you. Gag reflex is positive, so the test is good. Moving on, I'm going to do the neck. I'm going to palpate the carotid pulse, which is even in both sides. Next, I'm going to notice that the trachea is straight to midline. I'm going to listen to your carotid to note if there's any bruit. I'm going to check using my bell in 3 different areas. I'm going to check at the base of the jaw, mid-cervicular, and the base of the neck. Now I am going to move to the back of the client, and I'm going to note that coming back to the front, I'm going to ask the patient to do a range of motion test. If you will look up, perfect, down, left to right, ear to ear. Perfect. Now I'm going to ask that you shrug against bilateral strength is even. That's checking cranial nerve number 11. Now I'm going to come to the back of the patient, and I'm going to note that the thoracic cage has downward sloping ribs. The spinous process is straight. I am going to perform symmetric expansion at T9 and T10. If you will inhale. Perfect. Next, I'm going to perform tactile ephemesis. If you will say 99 and 5 times.
99, 99, 99, 99, 99.
Perfect. Thank you. Next, I'm going to check the patient's 9 breath sounds using my diaphragm. Inhale. That's 1, 2, 3, 4, 5, 6, 7, 8, and 9. 7, 8, and 9. Moving to the front of the patient, I'm going to ask the patient to repeat those 4 words for me, please.
Blue, moon, love, and smile.
Perfect, thank you. Now I'm going to ask that I'm going to note the patient's respiratory rate earlier was 16, normal non-labored breaths. I'm going to auscultate the patient's 5 breath sounds. You inhale. 1, 2, 2, 3, 4, 5, 5. Next, I'm moving on to the upper extremities. I'm going to note that the Skin is warm, no edema noted, smooth, even skin tone. If you will grab my hands and squeeze, perfect. Both, we have symmetric strength in both hands. I'm going to check cap refill is less than 3. Next, I'm going to ask the patient to lift up your arms. I'm going to ask that you push on your hips, muscles, and then arms like this. I'm going to note that there is no dimples, retraction, or legs, so no further investigation needed on that. Now I am going to ask the patient to lay down. Okay, I'm going to ask the patient to look to the left. I'm going to note that their jugular vein. I'm going to change the bed up to a 45-degree angle, and the jugular will disappear. Perfect. Now I'm going to put the patient back down to a 30-degree angle. I'm going to note that there is no heave or lift on the precordium. I'm going to palpate for the apical heart rate, and I do not feel it, nor do I see it. I am going to auscultate the apical for 1 full minute. Patient's apical is 83, which is normal. Now I'm going to auscultate the heart. I am going to auscultate first with my diaphragm, listening to the sounds for S1 and S2, which is going to be the aortic, pulmonic, Erb's point, tricuspid, and the mitral. I'm going to use my bell and listen for any murmurs in the same 5 areas: the aortic, the pulmonic, Erb's point, tricuspid, and the mitral valve. All were normal, no murmur noted. I'm going to check patient's skin turgor. No tenting. Now I am going to lay the bed flat, and we're going to do an abdominal assessment. I am going to note, if you'll lift your shirt up, I'm going to note the patient's umbilicus is midline, inverted, no hernias noted. The skin is smooth and even. Now I am going to auscultate my bowel sounds in 4 quadrants. Listening for 5 to 3 sounds per minute, 5 to 35 per minute. Next, using my bell, I'm going to check the vascular sounds in 7 different places. I'm going to check the femoral, the iliac, the renal, and the aortic on both sides. All pulses are not, vascular sounds are not heard, which is great. Now I am going to ask the patient, do you have any burning, rashes, lesions, or trouble urinating?
No.
No? Okay. So no further investigation upon the genitory tract. Now I'm going to move down to the patient's legs. I'm going to note that the smooth, even skin distribution here is distributed. No popliteal edema noted. And I'm going to check the patient's pulse. I'm going to check the popliteal, posterior tibial, and the dorsal pedalis. All are present, +2. I'm going to check the patient's cap refill, which is less than 3. Next, I am going to perform the plantar reflex. I'm going to do this on both sides. No flexion noted, so the reflex is negative. Next, I'm going to ask the patient to sit up. Okay, if you will close your eyes for me, please. I am going to, if you perform a sensation test, if you will let me know the places that you feel me touch.
Okay. Face.
Perfect.
Arm.
Perfect.
Leg.
Perfect.
Hand.
Perfect.
Foot.
Perfect. Thank you. Keeping your eyes closed, I'm going to check sterignosis of the patient. If you will put your hand out. Can you tell me what object is in your hand?
Whoops. A key. Perfect. What's the key?
Yes, ma'am. Now I am going to, if you'll place your palm open again, keeping your eyes closed, I'm going to draw a letter in your hand.
H. Or A.
A. You were close. Now I'm going to put your hands in a position. If you'll let me know what finger is out.
Thumb.
Perfect. Thank you. You can open your eyes. Next, I'm going to ask that you put your hands out and touch your nose. And move faster, rapid movements, smooth movement. Now I'm going to ask that you place your hands on your thighs and then flip one over and rotate them back and forth. Smooth, equal movements. Now I'm going to ask that you place your shin at the top of your heel at the top of your shin. The patient has smooth, even movements. I'm going to perform a deep tendon reflex test on the patient's patellar. Perfect. Perfect. Patient's deep tendon reflex was normal. If it wasn't, I would check the Achilles, the biceps, the triceps, and the brachioradialis. Next, I'm going to ask the patient to stand up. If she had MS, I would not be performing this test. If you will close your eyes and ask the patient to stand for 20 seconds with her eyes closed, making sure that she does not tip over. All right, thank you, Miss Angela. Next, I am going to make sure that there is no further need for a musculoskeletal assessment, no ETOH abuse, no physical abuse, and the patient's mental status is perfect, so there's no further investigation for that. I'm next going to ask the patient those 4 words.
Blue moon, love and smile.
Perfect, thank you. Is there anything I can get you at this time? All right, we are done with our interview. I'm going to wash my hands and go document my findings.